Thank you, Jagrana, so much for joining today. We are
Thank
going
you
to
for
talk,
having
yeah.
me.
We're going to talk all things gut health and microbiome. And I'm so excited because this topic still feels like a bit of a quickly emerging um, gray world to me. And so, I worked in the lab sector probably over 10 years ago now, and we had a naturopathic lab. And one of the big tests or topics that was coming up around that time was the issue of microbiome and gut health, and whether or not the diagnostic tests were scientific and what they could show about the gut health. So, can you just share, a basic 101 about what is the microbiome in terms of like evidence-based information? Like, what is this gut microbiome?
So it is, as you correct, a very hot topic, and it's a topic of huge research, but also popular interest in microbiome. What microbiome is, or we call it gut microbiota, which is most of the time when we refer to microbiome, is it's basically little organisms that live inside our gut. And there's lots of them. Many different species have been identified, and also we know those are the those are microbes, those are viruses, fungus, and phages. So different kinds of microorganisms that live inside our gut, inside our vagina, on our skin, in our mouth, everywhere. But majority of them is in the gut. What we did not know before, and the last 3, 4 decades, we are learning more and more about, is how important they are for our overall health. Because they actually regulate so many different things and processes in our body, we
Mhm.
cannot really live without this composition of the microbes in our gut.
Really
The average
interesting.
adult, average healthy adult actually has, upwards of a couple of kilograms of these microorganisms in our gut. My patients often ask me if we can deduct that weight when they measure their weight and BMI. Funny, but again, they are part of our system. There is also a push to actually define this as an organ because we cannot live without this living, dying, very diverse mixture that is inside our gut.
And in terms of, I've read things like eating sugar and um, some prescription pharmaceuticals that can, harm the gut or kind of create or support feeding the more unhealthy bacteria. What do we really know about that in terms, like what's sort of strong evidence that certain foods we eat are good or bad for our gut?
There's lots of research looking into that because what we eat will have direct impact on the inside of the gut. The microbes that we have inside our gut do love complex carbohydrates. They love to break down fiber and other things that are referred as prebiotics. So polyphenols, antioxidants, fiber, especially soluble fiber, will be great for the microbiome and will support their health. And in turn, they'll produce compounds that are actually very beneficial, directly beneficial for our brain, liver, heart, and everything else. So, what we know generally in a food, healthy, balanced diet with lots of fiber, fresh vegetables, fruit are excellent to support the microbiome. Green tea, even chocolate, stuff like that is great. But Western diet, which is fast food, ultra processed diets, very rich in sugar, can be detrimental to the health and will actually starve your microbiome. The idea is to keep the microbiome busy, abundant, and diverse because we have different bacteria that some of them actually will love sugar, but not many of them will actually process sugar properly. And most of us actually absorb sugar in upper intestine, so we don't really affect much microbiome with it.
Okay. Okay.
So there's lots of research looking into diet and direct impact of diet on microbiome.
Right. And so it's a great segue into this notion of prebiotic and probiotics. And I'm definitely a huge believer in terms of the value of I take AG1. And so and not, not paid for them by them at all, but I just find it's a good source that I've actually really noticed a change in my gut health because I've had some serious gut health issues. And so, though, what is the difference between a probiotic and prebiotic, and do we actually need both?
There's a big question, a question for like, 3 days answer, but very quickly. Probiotics are actually bacteria that we take from outside and we hope to support our health, whether supporting our composition of gut microbiome or supporting the health and well-being of our own microbes. And they usually leave, they don't colonize the gut, they don't stay in. But for something to be defined as probiotic, it has to be live, has to be defined, and also has to be an adequate amount, and has to be proven that actually makes a change to our health, improves our health. So any live bacteria, it's not probiotic because again, we have bacteria on our surfaces around us. We try to kill it, disinfect things. Our feces is abundant in bacteria. We don't take this as probiotic. So
Right.
probiotic is something that we have a proof it actually will help our health.
Okay.
Prebiotic is something that will actually support our own microbiome or probiotics that we are taking as the intervention. And prebiotics are fiber, polyphenols, antioxidants, and things like that. Not all fiber will actually be prebiotic. Morely digestible and fermentable fiber is prebiotic. So it's always great to eat abundant and balanced diet in kind of plants and your kale, sichard, cabbage, things like that, things that people don't like to eat or cannot eat for different reasons, then
Hmm.
you actually can refer to supplements. But thinking also in supplements, it's a large amount that needs to be taken in supplement to
Hmm.
actually have effect,
Right.
beneficial effect for the health.
Right. And so maybe I'm convincing myself of something that's working that might not be. And so when we get to the foods, so, you know, complex carbohydrates, the good fibers, there's a lot of talk around the kimchi and the sort of pickled. Is that extra good?
So fermented foods such as kimchi, sauerkraut, yogurts and stuff like that, those are foods that the composition is changed by bacteria that ferments that food. And quite often that food is much easier digested by us. Also, that food probably has some leftover, like dead bacteria in it, which also can be beneficial.
Right.
But quite often, by the time we ingest that and eat that food, there's not much live bacteria left in the product.
Okay.
So those foods are usually not probiotic, but they are very healthy foods. I do recommend them. If you
Hmm.
like them, absolutely go for it. If you can digest them and you enjoy them, but they are not actually going to provide enough of the live bacteria to provide health benefit.
And so if we wanted to start to get probiotics so that we're actually, increasing the good bacteria in our guts. Is that even possible? Like, what does that look like?
That's an excellent question. Our society, I think globally, modern society likes a quick fix. They like
Hmm.
to take a tablet and we don't have to worry and plan our food or diet. So the fact is, first of all, probiotics, I also am guilty of it. We use umbrella statement of
Right.
probiotics. Probiotics are like, vitamins. So do we need vitamins? Some of us do, some of us do not.
Hmm.
And if you have, osteoporosis, you need vitamin D, a
Hmm.
specific vitamin. Same if you have, I don't know, risk of traveler's diarrhea, you need to take specific probiotic for that. Or if you have inflammatory bowel disease or IBS, there are specific probiotic strains that have evidence for that particular issue. So not all probiotics will work. So, if you have osteoporosis and you take mega doses of vitamin C, it will do nothing for your bones.
Right, right,
So,
right.
as going back to our previous, the conversation, to support our gut, it's best to eat food that will feed a good bacteria and
Right.
avoid too much alcohol, avoid ultra processed foods, avoid smoking, avoid use of antibiotics if possible. So those are kind of things that will actually affect directly microbiome.
Hmm.
Certain medications that will suppress production of stomach acid, they are very popular. They are available over the counter or prescription. They will also affect the composition of microbes in a gut.
Okay.
And different corticosteroids and different strong medications can affect it. So if we can avoid or minimize use of those medications, we will actually have healthier gut. In some cases, we need to use it probiotic as intervention.
Hmm.
And then this is where it gets really complicated. You have to
Right.
look for a probiotic that has evidence for the particular reason you would like to take it for or to achieve the outcome for.
And do we actually have strong scientific evidence for, if you take this type of probiotic for this issue, or is it still a bit of a gray area in terms of evidence?
That's again great question. I've been trying to answer that question for past 17 years.
Hmm.
So I lead a group of experts that looks at the evidence, published clinical studies, looking at the effect of specific probiotics in human population to improve different health outcomes. And we compile that results in a type of chart or table or guide that's been growing, and every year we update. So we actually tell patients or healthcare professionals, if your patient has vaginal yeast infection and likes to take probiotics, here are probiotics or products that have been tested, and this is the level of evidence, or whether it's Health Canada approved or not, and this is the dose you use. So this is what we have been producing for like 17 years, trying to answer the specific questions, because there's only a handful, I guess, products listed in the guide compared to what you have available
Hmm.
in the pharmacies, stores, or online,
Yeah.
because those products have not been tested and we kind of hope that will work, but
Right.
we don't know.
And so that, I mean, the link to that resource we can share with the video. So, I think what the takeaway for me that I'm hearing is sort of rules of life that we apply to everything nutritionally is if we eat good, wholesome foods balanced with quality protein, quality fats, complex carbohydrates, fiber, we're likely in a good position. Um, and though, for people who maybe are struggling, particularly with menopause, some digestive issues can arise with that. And so if you are interested in sort of focusing on your gut health a little bit more, probiotics are really a very specialized thing that are only available in certain places that are true pro. But the prebiotic, there's certainly supplements on the shelf or that you could take for that. Do I have that right?
That is correct. When you say, for most of us that are otherwise healthy, maybe suffering different kinds of symptoms, we can look at the symptoms and take some probiotics for a short period of time for that particular issue. If you are, for example, looking to prevent bladder infections, there's a probiotic for it. If we know that we can get a yeast infection or vaginal bacterial vaginal infection, there's probiotic for that. So we know, if we anticipate something, we can use it to prevent. At the same time, as you mentioned, with probiotics in menopause, there's lots of research, lots of preliminary research in looking in probiotics and affecting the metabolism of estrogen in the gut and reabsorption of estrogen from the gut. So promising results, but we don't know whether that makes a difference for a patient going to menopause yet.
Mm-hmm.
As soon as we
Mm-hmm.
have it, it will be listed in the guide.
Mm-hmm.
So I'm looking forward to that.
Yeah.
Um, So with the just going back to the guide, initially we had in 2008 when we started one page with 8 products, 4 indication on it. Now we have hundreds of products and we have, I think, 15 or more indications that go beyond the gut. We have migraine prevention, we have mastitis, we have gestational diabetes, etc. So we have other indications as the evidence becomes available. So hopefully menopause and menopause symptoms will be one of the new indications once we have enough evidence. Going back to prebiotics and good food, always great idea, especially when we go into perimenopause, crazy changes start happening, and adding maybe specific fiber to your diet. And what we know, there is evidence for the ground flaxseed. Very simple, very affordable and accessible. The ground flaxseed contains soluble fiber, insoluble fiber, and lignans. And lignans actually will allow our body to eliminate any excess estrogen, which in perimenopause happens because we have those surges that
Right.
are unexpected with estrogen. And at those times, it will regulate it.
Oh,
So it's
interesting.
helpful and it's simple intervention.
Well, in talking about, in postmenopause when the estrogen's low, perimenopause where, it starts to drop, so your brain tries to overproduce it, and you end up on this up and down roller coaster. And as it relates to the vagina and the vagina microbiome, I understand that estrogen is a food source for the healthy bacteria in your vagina. And so as that drops, that bacteria dies off and the less healthy bacteria can propagate, shifting the biome, the moisture, the odor. And so, how important is estrogen or other hormones for the gut?
Uh, it is very important, as you mentioned, the vaginal area, genitourinary area is extremely important, dependent on amounts of estrogen. So estrogen, local estrogen, is definitely always the best first line, and most patients can safely use it. It is prescription, so it definitely has to be in a conversation with your provider,
Mhm.
but supporting the lining and of the vagina and that whole area and the bladder as well, in addition to estrogen in menopause, you can also think about potentially adding those probiotics I mentioned earlier that have evidence for the vaginal yeast infection and bacterial infection. They also have observed they change something we call the Nugent score, which
Okay.
basically tells you about the levels of bacteria inside vagina and whether it's healthy or not. So those probiotics also improve your Nugent score. So I get basically keeping the inside composition of the vaginal microbiome healthy.
Oh, I've never heard of the Nugent score before. And so is that like a swab test or what does that look like?
It is a swab test, yes.
Oh, okay.
Quite
Interesting.
often used in studies in research to actually determine, or analyze and effectiveness of different interventions we have to clear, infections, being yeast or bacterial infections.
Okay. Okay. And that's great. So, when one of my little hobbies is I love going to various stores and checking out what new products are coming up. And so I can't get over the number of companies that are rallying to put either, they're claiming to have probiotics, but prebiotics in everything. So, the electrolyte drinks, the bars, the shakes, the everything seems to be. So before it felt like, it was just going to a health food store and they would have a section of prebiotic and probiotic, and that was confusing enough. And then it kind of went into mainstream grocery, but still like now it's integrated within all these products. And so, I'm a bit confused. You can kind of park your common sense a little bit, but we only have so much money. So, what, if any, is a good rule of thumb for women if they're thinking, I would like to introduce a prebiotic, um, just to sort of round out my eating and be a little bit healthier to my gut. Is that a crazy question, or is there some guidance around that?
This is excellent question, and I would say that there are excellent evidence-based resources. So I would suggest, and we can probably add the link you
Yeah.
mentioned before with the probiotics. We have Alliance for Education on Probiotics. We can add the link here. And also there is International Society, Scientific Association for Prebiotics and Probiotics. They have a whole section on prebiotics. They'll tell you exactly what foods or what supplements actually will have effect on overall health and how much you need. Because sometimes if you have a chewable gummy with 1 or 10 milligrams of prebiotic, that means you have like 1/8 of the teaspoon of inulin. That is, you can have in one asparagus, you have probably 10 times more inulin. So it's, whether you need supplement or you can actually get it in food. Some people struggle with food affordability, struggle with maybe
Hmm.
digesting different foods. In that case, you might want to search for a good supplement. But again, look at the amounts, look at what's available. I don't like to mention brands ever, but
Yeah.
look at a ISAP website. We can add a link to that. It's a great resource to actually find out what would be good food or good supplement to try.